Hello, this is Greg Toso with TMS Psych Support. This brief presentation, LinkedIn, an important tool to help build your TMS practice. This presentation includes the following topics. Why is LinkedIn an important tool to help build your business? How to expand your LinkedIn connections. How to use LinkedIn to increase your TMS therapy practice. Real life information on LinkedIn experiences, and some hints to be more successful with LinkedIn. So why is LinkedIn important? First is that LinkedIn does a great job of SEO, your name, for the search engines, including Google. And that's why your profile is very important. In your profile, you should talk about your expertise in treating depression and other mental health disorders, along with your TMS clinic and what it's done for patients. So that's a great way to have your profile there and let it appear on the search engines. Also, LinkedIn allows you to connect to other healthcare colleagues in your area, and we'll show you how to do that in the next slide. LinkedIn also provides you with their email addresses of those individuals you connect with. So you have their email addresses if you want to send out any information through an email blast or personal one-on-one. Additionally, within LinkedIn, it allows you to personally send them a message or post to your particular page a group message. So that's why LinkedIn is a great tool for you to use to communicate with individuals that have an interest in mental health. So how can you build and expand your LinkedIn connections? A great place to start is at your practice referral list. This should be a driver for you to either develop the list or to use the list. Once you have that list, you can go on to LinkedIn and you can look for those individuals and you can connect with them. Another good way to develop a list is to go online, go to Health Grades, Vitals, Yelp, Yellow Pages, and White Pages, and look for particular physicians or particular physicians within a specialty within a surrounding zip code of yours. And you can do those on several of these services, and that can help you to develop this list and then use that list and go on to LinkedIn and find them. Another way to do it is for the local medical professional societies. Each of you as psychiatrists likely belong to the state and also your local group, while other specialists also join those groups too, and you may be able to find out that list by calling that society. Another way is with online groups. For example, in LA and in New York, I know that there are psychological associations that have their own website that list their members, that you can find out who is around you and how to connect with them. And then you can go to hospital directories, and I'm sure that you can also consider options for yourself. Another great opportunity is one that LinkedIn presents to you. LinkedIn will ask you continually, do you know so and so? What they're doing is they're looking at individuals that you're connecting to, and they're seeing if you can find like individuals that you possibly know. And so that's a great way to build your LinkedIn connections. The other way, which is a little bit more work but makes sense, is join local LinkedIn groups that that is in the same geography as you. So you can join the psychological association that's local to you, that group within LinkedIn. And that's another way to post on that group, and also another way to find out members that you can attract to belong to your connections. So how to use LinkedIn to increase your TMS therapy practice. The most important piece of information here is that you need to provide fresh content to individuals that you're connected to so they can perceive you as an expert in depression and mental health. So you're a go-to person. The way to do that is to provide some practice-specific news. So you can post your clinical results and you can update them on those. You can update them on TMS case studies. You can do special papers on TMS versus ECT, or perhaps TMS and the use with medication, or TMS in the treatment-resistant population. Anything to get them to identify you as an expert. Recent clinical studies that may have come out from the FDA. Practice updates about your practice, new hires, job openings, insurance coverage, You can also update them on current news, articles on mental health. If there's a video interview that's come out on a major TV station or even a smaller TV station, update them. TMS specific, or it can be specific to mental health or specific to other things that may be of interest to that group. If you're going to the APA, there's another way to do it. In May, update your list on what you've learned at the ATA. How about timely events, things like Depression Awareness Week or a video that maybe you've seen out there on depression? Those are ways to update your list of connections. You can do your blogs, and also newsletters is a great way. That's one thing that we try to do at TMS Psych Support, is provide newsletters so that you can keep 6 connections every year with this group, and you can build this group and you can keep them connected to you. Now let's take a look at our LinkedIn experiences with our TMS providers that we service on LinkedIn. The first is, we find that 1 out of every 2 social workers tend to be on LinkedIn. We find that roughly 1 out of every 3, 1 out of every 4 psychologists and therapists are on LinkedIn. And we also find that about 1 out of every 7 to 10 physicians are also on LinkedIn. Now, and it's growing every day. Now, what this means is there's a great amount of referral opportunities or relationship opportunities that can be gathered from LinkedIn. These are individuals that you should connect with. Let's look at other experiences we've had in using LinkedIn. When we've used the LinkedIn email addresses in conjunction with an email blast, we find the following. We find that there's a 40 to 60% open rate of that email. That's significant considering that industry average for email blasts is 2 to 15%. And I've even purchased lists that have been less than a 1% open rate. Also, the click-through rate is about 20%. What that means is those who have opened up that email, the 40 to 60%, the click-through rate, or them going a little deeper, is about 20%. So 1 in 5 of that 40 to 60 are trying to find out more information about you. And hopefully that information is compelling, where it presents you as an expert in the area of depression and other mental health disorders, and a leader in TMS therapy. Now, another significant fact is 50% or more of those individuals that you send an email to will have at least looked at who the email is from and what the subject matter is. And that means that's another opportunity to have identity with your brand. Lastly, we find that the opt-out rate for those LinkedIn connections is very, very low. I think I found probably less than 5 in over 3,000 email blasts that I've sent out using LinkedIn. So let's review some hints for you to be successful on LinkedIn. The first is to visit your LinkedIn page for 30 minutes twice a week. Invest at least that much time in order to respond to questions from your network, to send any personal notes to some targets or connections, and to expand your LinkedIn connections. Again, LinkedIn will present a number of individuals that you may know. Now, some advice on expanding is focus on adding healthcare professionals to your list, those specifically that may be first-line caregivers for mental health that you want to connect with. At the beginning, be sure to avoid adding friends, family members, patients. Be selfish, go business to business, build this list with in mind a potential referral source. This will make it much easier for you to segment the list, and it will also make it more appropriate that when you have postings, it will be to the right audience. The other is to post regularly. You can post about a lot of things that we just reviewed in a previous slide. You can also be sure to keep information educational. Avoid overselling. The key here is to build relationships. So how can TMS Psych Support help you? Our goal is to keep your message and brand fresh in the minds of your colleagues that are on LinkedIn, patients that are in your practice, and also potential patients out in the community. We do this by providing a plan, content, and delivery for this type of messaging. If you're interested, just give us a call, 610-750-3039. You can email me at greg@TMS Psych Support. You can also visit our website to understand more about the things that we offer. And I would encourage you, if you do visit our website, to join our Twitter feed for helpful hints that occur on a regular basis. Thank you for listening today. Please visit the blog, post any comments you may have, and I'll look at those comments and I'll respond back to those. It's great to have you here, and I look forward to getting to know you better. Bye for now.